Hello, viewers, and once again, welcome to Healthy Wrinkles YouTube channel, which is devoted for better healthcare for every senior citizen of the country. We have Dr. Prem, once again, who is a leading geriatrician from Jaslok Hospital, Mumbai.
Thank you. Thanks for having me.
Last time we had a conversation with Dr. Prem, and I'm sure he will make a reference of that conversation about vaccination, especially in the adults and senior citizens. But our today's topic is specially devoted for COVID vaccination. So Doctor, my first question is, the current protocol or recommendation is that all those are above 60 of age and those are having 45 to 60 age group, but having some other diseases or comorbidities, they are recommended COVID vaccination. So you as a geriatric expert, what have been your views and what is that you are recommending to your patients, doctor?
Yeah, at the outset, thank you to have me back. It's always a pleasure. So the thing about vaccination guidelines, which the government is following, I would say is it had to be phasic because our population is huge. So what had happened is they had to come up with a strategy in which we know that the vulnerable population is the older population, but you have to make the health system more stronger. So the frontline workers were obviously given first. And in that also older adults are there. So that was a silver lining in which that a lot of people were able to see what is happening with the older adults who are healthcare workers getting the vaccination. So it is not that it's 60 plus healthcare workers have already got it. The number might not be huge because in general, healthcare workers number is not huge in India, but it is good that people were able to see side effects if they are there any as far as a layman is concerned. So that is there. Secondly, it had to be phasic because you have to understand the 60 plus population is not less in India. It's a huge population. Now, the strategy which the government is still working on is how to reach people who can't come to the hospital because there's a huge chunk of that also. There are people who are bedridden. There are people who can't be brought to the hospital. So there are people at elder care centers who have been in that ecosystem throughout COVID. So they have not actually got out at all. So those strategies are also well on the way so that they can address that also. But as of now, I think as a geriatrician, it's a good way because we are covering the 60 plus, but at the same time, we are also making sure that 45 plus comorbidities are being taken care. So people from 50 plus are actually being taken care in a way because 45 without comorbidities. And then the next line of vaccination is the huge one in which you are talking about the people who might be working. People are actually going out. A lot of them might be working at home also, but the youth, that is the 18 to 45, is the one which might be a huge chunk, which we are actually sort of waiting. But I think priority-wise, this is the way to go, and I think it's the right strategy.
Right. And doctor, also we understand and we read, in the media that, there are two types of vaccines probably, are currently available in India. And is there any preference or if the patient is offered any of the vaccine, he or she should go ahead and take that vaccine. So from a user perspective, is there any difference?
Yeah, I would say as far as the user perspective is concerned, see, both of the vaccinations, they have undergone trials. In fact, just to tell you, it's two vaccines which are available in India. More are going to be available. So when they come in, we can talk about that because we ourselves will know what is happening in the West and then we will try to get them here purely because that's where it has been introduced first. Now, Covaxin and Covishield. Now, Covishield is, of course, been made by Serum Institute of India, which is nothing but the Oxford AstraZeneca vaccine being made in India. So that vaccine has been made by Serum Institute, which is known to do a lot of work in vaccination. So the organization is not something which is not respected. It is hugely respected. The fact that in a short time they are being able to do this is also kudos to them. But it's not been a short time. That's what I want to tell my viewers. Since the day the virus has started the pandemic, people have been at their work. So don't feel that this is just some rapid thing which is been done in few months. No, work has been going on since almost an year. Now, when you get into the public domain, is a big thing because there are phases of trials, which all of people would have heard, 1, 2, 3. And recently, the problem with Covaxin was they had not submitted the phase 3 trials, which they have now. So that also has an 80% efficacy. So I won't say anything is superior. Both have very much similar sort of efficacies. Both are around 75 to 80%. But you have to understand that both are different. So you can't get one shot of Covaxin and one shot of Covishield. Let me be very frank. If you take a first shot of Covaxin, you have to take 28 days later Covaxin only. If you take Covishield, 28 days later Covishield. Another question which I might address directly is, a lot of people must be thinking, people are saying the duration can be increased. There have been saying you can take it at 6 weeks, you can take it at 8 weeks, you can take it as much as 12 weeks also. But my only thing is, since we are in a vaccination drive, I am not sure when your turn will come if you choose not to take it after the 4 weeks. So as of now, my advice would be, when your call comes for the second dose, just take it, purely because we are in so much of burden of covering the population. And we have not even touched the 18 to 45 yet. So that is also a huge amount of population. Now, just to go to the basics, see, Covaxin and Covishield. Now, Covaxin has actually the inactivated coronavirus itself. And what will happen is, see, again, the doubt will be, oh, we are taking coronavirus only. What if it gets activated? No, it's inactivated and it will not cause you infection. Again, it will not prevent COVID. It will not prevent you from having COVID entirely. It will basically build antibodies in your body and it will be ready. So once the COVID virus attacks you, the body will be ready to actually take care of it. Covishield is basically you can say an adenovirus taken from a chimpanzee, which is very similar in structure to actually the coronavirus. And it basically, again, works the same way. It basically gets our immune system ready, the so-called defense system, that, the antibodies will be created. So once the COVID actually attacks us, we are obviously able to sort of fight. Now, Covaxin is also from Bharat Biotech, which is also known for a huge number of vaccines. So I think there are no preferences according to me. Whichever center you get, whatever, please try to take it. Both have been labeled as safe only. There have been a lot of reports recently of clots actually been forming with Covishield, and most have been refuted. So it's still considered to be quite safe. Remember, when you sort of choose, if you have a choice, then you can choose anything. If you don't have a choice, there is no harm in it. Don't worry about it. That is what I would like to tell the older adults.
I think that's a very practical advice, doctor.
Another word of caution before we go to the next question is, once you take both the vaccines, whatever duration in between, 4 weeks ideal, that doesn't make you safe entirely. Studies clearly show the titer of antibodies slowly increasing. You see it after 1 week, you see it after 2 weeks, and later the efficacy improves, the more the duration. And after the second dose, when you actually see your antibodies after 2 weeks and 4 weeks, that is when you will be able to know whether your immune system is actually working on it or not. Then there is also something known as a spike antibody, which people are doing. So that will clearly tell you whether your body is actually reacting to the vaccine or not. So you will not be protected the day you take the vaccination. Let me be very frank. So the 3 things still remain the same. Wear your mask. Keep your social distancing, not social isolation. I'm telling you, don't get yourself isolated, but keep your social distancing. And please continue to sanitize your hands, whether it's with soap and water at home or whether you're outside when you won't get it with hand rub or the sanitizer. Please continue to do it. Getting the vaccination does not give you freedom of throwing away the mask, which most people think it will.
Yeah, I think that's a very wise advice, doctor. So, doctor, what one can expect immediately after vaccination in say next half an hour, 1 hour, and maybe over the next couple of days? So, what one shall expect?
So, as you said, half an hour. For the first thing, for your mental peace, you will be kept at the center for half an hour after you have taken the vaccination, because we need to see you for immediate side effects. So which could be anything, because it's an injection, it's a vaccination, it's technically a foreign body. Your immune system could just react very badly to it. And that is something known as anaphylaxis. If you have had a history of anaphylaxis to any vaccination, please do not take, because that is a history which is important. Do not hide any history because, oh my God, I don't get the vaccination, I won't be prevented from the COVID disease itself. No, don't do that as well. Then another thing is, there are very usual side effects which we expect. One is you might get local pain because it's going to be given in the shoulder, whichever hand you want. And the local pain of the injection will be there, and it usually might last for a day. Certain people have had a bit of head heaviness, headache, fatigue. All these things will usually last only from 24 to 48 hours. There have not been major side effects which have been seen, but these side effects, even if you have fever, which is not very significant, that is also expected. That is just a way of telling that your immune system is actually working. But do not get worried if you don't get anything, because a lot of older adults are not getting side effects also. That doesn't mean your vaccine is not working, because 2 days is no time for you to even know that the vaccine is, the body has actually started reacting and started making antibody. So don't get worried. But the general thing is, these are the side effects. If you have very bad side effects that I can't tell you. It varies from different people. If you get side effects, please do not just hide it. You're suddenly getting a lot of breathlessness. If you're getting too much of headache, if you're getting things very high fever, please get in touch with your healthcare provider. Do not hide those side effects, because these are, let me be frank, the government has made it very, very oil process that the side effects also have to be documented. So you need to tell them also, so that adequate effects are taken. And in general, what is happening is paracetamol is being given even at the vaccination center. So I would advise maybe you take it that day for 2 doses, and maybe the next day if you continue to feel, for 3 doses, and then you can stop. This is just a general advice in which you can be prepared for any particular side effects. But there have not been very major side effects. Please do not go on news items which keep saying people have died after the COVID vaccination. Please see what is actually, whether they had any comorbidities, whether they had any other issues. That is why the death has happened. Because it's very easy to get a headline, but that's not that. And even if it has happened, it's not happened in a huge amount of population. Whether things will happen to you or not is very difficult to say. But since vaccine is the biggest protection you have, along with the 3 precautions I sort of told you, so I think that's the best bet. And my final message is, please still stay safe, because ultimately the pandemic is not over. The spike of cases has been seen, but it is nothing related to whether the vaccination drive has been started or not. It is because there have been a bit of irresponsibility on the part of people not taking precautions. So please, mask, hand sanitization, social distancing without social isolation is to be practiced. Be in touch with your near and dear. Keep yourself busy. Don't forget your health. Your physical, mental health should be taken care of. But get the shot, because that's going to give you strength overall. Do not be afraid of it. If you're afraid, please clear your doubts from your healthcare providers like me or anybody else, and then go for it. Do not be in a dicey way and then go for it. So that's my final message. Get the shot, but believe in it.
Thank you, doctor, for providing those insights, and wonderful. And I'm sure viewers are going to get benefit out of it.